Bismillah ar-Rahman ar-Rahim. Our case today very interesting. This is medical metabolic emergency. Just to finish now her management with inherited metabolic team. Our case today 3 days old girl, full term 37 weeks, presented with symptom and sign of neonatal encephalopathy 3C, confusion, convulsion and coma, and there is family history of positive consanguinity and unexplained death and positive metabolic disorder. Clinically, the patient presented with hypotonia and hypoactivity. Hypotonia, it will be axial or truncal hypotonia, and limb or appendicular hypertonia, and patient was lethargic and myoclonic seizure and lip smacking, and our impression at that time sepsis, then cardiac and metabolic. But the history and the clinical examination, it goes with metabolic disorder or inherited metabolic disorder. So inherited metabolic disorder or patient presented with neonatal encephalopathy, how to differentiate? By metabolic acidosis. Encephalopathy without metabolic acidosis, sometimes it will be alkalosis or normal blood gas, it will be urea cycle defect or maple syrup urine disease. So encephalopathy without metabolic acidosis or normal blood gas, or might be alkalotic also, it will be urea cycle disorder or defect and maple syrup urine disease. Encephalopathy presented with metabolic acidosis, this is organic acidemia and congenital lactic acidosis. Organic acidemia and congenital lactic acidosis. Organic acidemia, it will be what? Propionic acidemia and methylmalonic acidemia, and also isovaleric acidemia. And put in your mind glutaric aciduria type 1, glutaric aciduria type 1. So put in your mind, this is metabolic emergency. It will be encephalopathy without metabolic acidosis, urea cycle disorder and maple syrup disease, and also encephalopathy with metabolic acidosis, organic acidemia and congenital lactic acidosis. Organic acidemia, it will be propionic acidemia, methylmalonic acidemia, isovaleric acidemia and glutaric aciduria type 1. So this is our impression. So how to proceed? You have to consult immediately the inherited metabolic team, and you have to request it for such cases, urine for organic acid or amino acid, and you have to request for blood, ammonia, lactate and glucose and blood gas, imaging, ultrasound and ophthalmological consultation, and you have to consult inherited metabolic team. If there is hyperammonemia, this is called medical metabolic emergency, and you have to start sodium benzoate or sodium phenylbutyrate and L-arginine. If there is organic acidemia, you have to decrease the protein and increase the glucose and start L-carnitine. So you are decreasing the catabolic state and improving the anabolic state. If there is fatty acid oxidation defect, so you have to prevent prolonged fasting, and you have to consult the metabolic or inherited metabolic team. If there is lactic acidosis, you have to start dichloroacetate and biotin and L-carnitine and thymine. So our case, this is metabolic medical emergency. Neonatal encephalopathy, you have to put in two categories: with metabolic acidosis, without metabolic acidosis. Without metabolic acidosis, sometimes it will be normal gas or alkalotic, it will be urea cycle defect and maple syrup urine disease. If there is acidosis, baby present with encephalopathy with metabolic acidosis, organic acidemia and congenital lactic acidosis. Organic acidemia, propionic acidemia, methylmalonic acidemia, isovaleric acidemia and glutaric aciduria type 1. ومن أحياها فكأنما أحيا الناس جميعا. شكرا، سلام عليكم.